This is the other one. This is where that research is performed. Where is that research taking place? So again, if you look at business enterprises, 51% in high-income countries and about 35% in Canada. And you look at universities and teaching hospitals, it's 28 and 60%. So again, there is a significant difference. And I think we really need to look at this carefully. And that speaks volumes of the need for our universities to work a lot closer with industry and to develop those ties and the strong networks that we need to have in order to be more competitive internationally. This is from our last benchmarking as well. It's the 2008 OECD data. I'm just waiting for the next release. Switzerland, again, was #1 in pharmaceuticals. Canada was number 14 out of 15 countries, and again, was a D. If we look at the pharmaceuticals, and that actually includes biotechnology companies in Canada as well, the main difference between Switzerland and Canada, our industrial sector in Canada, in the biotech, is really small. We have very promising companies doing very interesting research, but they are very early companies. They are not at the point that they have products that they are making any money yet. Many of those companies are struggling financially, and we can talk about why that is. I think we need to be looking carefully at our policy basis, nationally and provincial. Now, the situation is not that different for medical devices. This is what it is for medical devices, and actually Canada is 15 out of 17 countries. Again, very much the same story. Medical devices tend to be small, not very large players in the world. And we consistently actually import a lot more medical devices than one we export. So we continue to have a negative trade balance here. Now, why this matters for healthcare? I'm going to go very quickly because I'm sure you have seen this many times. This is the healthcare cost as a share of provincial revenues in Canada. This is the trend we have seen is going up. And it will continue to go up, probably. Why? Mostly because, well, there are many reasons, but one of the most important is demographic trends. This is our population. It continues to go up, and we know that the people over 65 consume the greatest share of healthcare costs. Why is that? It's because of chronic diseases, mostly. And we know that people with multiple comorbidities actually consume a significantly greater amount of healthcare resources. The challenge is that this is our current fiscal environment. We did this based on the projections that the provinces did for the latest budget, so we don't anticipate anybody to be on black until 2016, 2017. And that creates tremendous challenges for healthcare. In Ontario, for example, the government is hoping that they can balance the budget by 2016 with only 2.3% increase in their budget for healthcare. We know that this is going to be extremely difficult. They have aimed to have 5% in the past, and they have never been able to be under 7%. And now they need to be 2.3%. So that has tremendous consequences for healthcare. And when we talk to the healthcare administrators, they understand that they need to become a lot more innovative. And it's about delivering more and enhancing more value with less money. That's what innovation is really all about. It's how they can be a lot more competitive. When we ask them, and this is a survey that we are trying to identify, because as Didier mentioned and Chris mentioned, we have tend to focus more on the supply side when we focus on policies, not so much on the demand one. That's why we've been focusing on innovation procurement. When we did a survey, this is a survey of healthcare administrators, and we asked them, this is about their overall perceptions and attitudes about innovation in Canada, in healthcare. Now, they understand that innovation matters. 100% of them agree that innovation is essential for the sustainability of Canada's healthcare system. They either agree or strongly agree. Now, it's about 70% of them actually said that they had designed and implemented plans to achieve innovation targets. There seems to be a disconnect. Yes, it's a very good idea, but not everybody is actually doing something about it. Only about 22% identify that their boards had set clear and measurable innovation goals. And so that's a problem. Now, of course, the administrators completed the survey, so about half of them said that they have identified some innovation targets. But when we ask them about how they support that innovation within their organizations, we have 64%, about 65%, said that they agree or strongly agree that they encourage individuals to transform ideas into new services, processes, and products. But then about half have actually implemented something and recognize and reward the individual's innovation performance. And we know from studying innovation that the top companies that innovate and they're leaders in the market do this. This is extremely important for success. Only half of our healthcare organizations are there. I think my time is running almost out, so I just have a few thoughts. I'm happy to have this conversation in the panel and maybe afterwards as well. We have an innovation strategy for Canada. The federal government set one for Canada. That innovation strategy had actually highlighted life sciences as one of the pillars of strength for Canada. And we agree. We have excellent research that happens in Canada. We have great universities. We have very good infrastructure. The ingredients are there. But we haven't been able to articulate a life sciences strategy sector that actually supports and nurtures that sector so that it continues growing and getting strong. We need to do that very urgently. When we look at what are some of the key elements that should be included within that strategy, given the amount of health research that happens in universities, we really need to find a way to strengthen the collaboration between universities and life sciences industries. And not only universities, that also includes teaching hospitals and a lot of the healthcare sector. Because, as you mentioned, Chris, innovation happens between, innovation it doesn't happen within a lab, it happens at the hospital setting, where the patients are, where the healthcare are actually delivered, where those services occur. So that collaboration is extremely critical. And we know that in Canada, for a long time, if you invite an industry, a medical device company to come to a hospital, not everybody might agree that that's a good idea. So overcoming those cultural challenges is extremely important, very important. Encourage the slow adoption of innovative health technologies in Canada. We need to do something about that. We're a slow adopter of technologies. And there is no justification why information and communication technologies in healthcare is so behind the banking sector in Canada, for example. We are leaders in some areas and we are so behind in others. And without information and communication technologies, for example, it's very difficult to, what Didier mentioned at the beginning, it's all about tracking performance and then sharing that with people. How can you track if you don't have the tools to do the good tracking? When we talk to people from other countries, they always think that Canada is a heaven to conduct clinical trials. Well, we could be. I mean, we have a single-payer system. We have a way that we can get a lot of information from patients. The problem is that we don't have an electronic medical record in many of our provinces that is actually working, and we can exchange that clinical data, and we can mine it. So that is a huge problem. Harmonize the multiple and conflicting regulatory regimes across Canada. This is another key issue for companies to, when they decide whether I need to set my company in Canada or in another country, this is a problem. Not only we have a healthcare system that is not necessarily welcoming for new and innovative technologies. In a sense, I mean, we have the early adopters. They are everywhere. When you try to send that province-wide, it's a lot more difficult. Then the other problem is how those technologies are evaluated, assessed, and integrated into a system. It's a very slow process, and it's very cumbersome. IP, Didier mentioned this, you have to protect your ideas. So having a very strong intellectual property protection system will encourage a lot more private research and development. And the last one, I already mentioned that. I'm out of time. Innovation is really not about something that you do for an endpoint. Innovation is a journey and takes there is value added in each one of the pieces that you take. That's my email address, our website.